earlier this week. Well, how medicine is practiced has changed a lot throughout this pandemic, and that includes telemedicine, which people have really adapted to. Joining us now to talk more about that is Dr. Johnathan Kost, Medical Director of Hartford Hospital's Pain Treatment Center. Doctor, welcome.
Thank you so much for having me.
Thank you for being here. So how has telemedicine and also digital health apps been used by the Pain Treatment Center in the wake of the COVID-19 pandemic?
Like most medical practices, COVID-19 resulted in us using telemedicine essentially overnight. Although it does not replace the actual in-person visits, it has been an extremely valuable tool in maintaining communication and checking on patients in between visits, etc. We at the Hartford Hospital Pain Treatment Center and the Spine and Pain Institute at Midstate began utilizing also, we developed and started using this web-based application that is HIPAA compliant that monitors patients in between visits as well, that provides us with an enormous amount of information pertaining to the patient.
How does that work? You actually track them and monitor them?
Correct. So, typically patients come in every 3 to 4 months for visits, and there's such an immense amount of lost data. When they come into the office, we see how they're doing, but now we have the ability to basically monitor how their pain is, how their functional level is, depression, anxiety levels, which is very common in chronic pain patients, medication side effects, treatment effectiveness, whether it's procedures or medications, vital signs. We're able to monitor that all between visits at this point. So it's an immense amount of information. We get data alerts when there's extremely high levels of any of those categories. Patients can communicate with us real time in between visits utilizing applications such as this. So it's been an extremely valuable tool going forward.
And can you describe the way this helps make pain management more personalized and precise?
So basically, it's critically important in all fields of medicine for the patient to become an integral part of their own care. What guides the basic treatments in medicine is information. We need data to guide treatment. And the more information we have, the more current that information is, the better we can treat patients.
Interesting. All right, tell us how else digital health apps are being used. Can they be used for patient education and to share safety information?
Oh, absolutely. So now we have basically a conduit of a connection to patients directly. So we're able to send out to them information regarding maybe procedures coming up, side effect profiles of the medications that they're taking. If they happen to have any issues, they can communicate with the offices now. It's really a game changer in medicine going forward, and an ideal time, especially during this pandemic.
And it really is so easy. I think everyone in my house has done televisits, and it's so easy. It's unbelievable. All right, Dr. Johnathan Kost, thank you so much for joining us. We appreciate your time.
Thank you.